During the journey of our life, each one of us has faced or going to face changes in the personal life or in the career life. These changes may be due to a simple thing that happened to us recently or in the past. Sometimes we couldn't remember when exactly it happened. We may have seen these changes already, or we are going to see them sooner or later, even after many years. And this is exactly the meaning of butterfly effects, where simple small things can make a big changes. I would like to share with you one of my personal stories that really had made a big effects in my life. The time I was in Egypt in the final year of secondary school and I decided to study architecture. I like to design, I like to decorate, and I was captivated by the unique Egyptian building designs and Egyptian museums and temples as well. To study architecture at that time, I had to go through pre-university skill exam. For a reason, I missed the exam, and I had to choose between medicine and pharmacy. I settled with medicine as it was a good option for me. Frankly speaking, being a doctor helped me to find a job just after graduation and helped me to find a job in Saudi Arabia and in Malaysia. I do believe that doctor job is always in high demand. And when I recall back my journey from secondary school till now, I think it is one of the major butterfly effect in my life. And I'm very happy of what I have now. I'm using this concept of butterfly effect when I treat my patient, especially when I prescribe narrow therapeutic range medication. And in a simple way, therapeutic range of any medication is the level of this medication of the blood at which this medication will be effective and safe. And usually we achieve this level by proper dose of this medication. But when the dose increased, the level of this medication become high and become toxic, and of course the patient will suffer from complication and side effects. And if we give the dose lower than should be, the medication may be in the blood but no effect. So when I prescribe such narrow therapeutic range medication, I have to be very careful about the dose because any small change of the dose may result in toxic effect or no effect, unlike wide range therapeutic medications where we have some flexibility of the dosing. These are my personal experience and my job experience related to butterfly effect. And I understand you may not concern too much about them because it's my own and it's already passed. And maybe you have another career as well. But I think we all are involved in this bad pandemic, this COVID pandemic. And we all think how this small virus, which diameter of 0.12 micron, smaller than red blood cells, can't be seen by our eyes, but we need a special electronic microscope to see it. With that, have this all impacts in our life, in all aspects of our life, health, education, social life, traveling, and also job career. Suddenly, we find some jobs increase in demand, such as information technology and digital marketing. Some of jobs dramatically decrease in demand, which are the jobs related for tourism, for example. And certain other jobs still maintaining, such as food industry, and some of the industry actually changed the productivity. Like, for example, those who used to design casual wear, now they are doing face mask just to do some change to survive. This fluctuation of the job demand make many people reconsider and rethink their future plan for their career. And actually what we are seeing now is the short-term impacts of COVID only. I understand is already 1 year plus, but still considered short. I understand that we started to have vaccines and we are trying to do our best to control the virus, which we don't know when exactly can be done. However, even we control the virus, I don't think this impacts will be end with the virus control. So I have one question here, which is, what is the impact of COVID-19 on future career? Actually, being a doctor, I would like to use Dr. Job as an example to answer this question. And let me to ask you, what do you think with the current COVID pandemic? There is demand on doctors? I think logic, yes. We need more doctors. Still COVID not under control. And actually many countries, they recall retired doctors to join the service again. So the answer is very clear. But if I change the question, I say, with the end of COVID pandemic, do you think doctors' demand will be the same? Here we might have some controversy. One group will say, yes, doctor job is always in demand. And we had many experience of pandemic before, and still we need more doctors. Plus, what we have learned from this COVID, that we need to upgrade our health system, and we need to assign more doctors and more medical team, so it will not be affected. Other team will say, or other group will say, yes, it might be affected, because also during COVID, we had developed a lot of medical technology which may replace the doctor physically one day. And actually, third group will say, in terms of the demand, we are not sure, because what we can see now is some of the students or pre-university students, they change their plan to study medicine because they have some concern about risk of doctor job and also about the availability of the job after graduation. These three dialogues actually is the summary of two calls I received from my friends. I received call from one of my friends around 2 or 3 months just before declaration of COVID pandemic. He called me, Khaled, I want your help. I said, okay, sure. He said, I want you to nominate a good medical school with reasonable fees for my son because he wanted to study medicine. And I encouraged him. So I said, sure. For me, the decision was taken, and my role is just to nominate medical college, which is already done. Recently, he called me again and he asked me, Khaled, I need your help again. I said, okay, sure. The time I thought that he wanted my help to guide his son in studying, but he told me, unfortunately, I cannot pay the fees of my son because of financial problem. And he still like to study medicine. So if you can recommend medicine related courses for him will be good. I felt sad because I wish that everyone get what he wants. But suddenly I remember my story. And I told him I wanted to talk to your son. He said, sure. So I called the son and told him about the alternative medicine related courses, such as biomedical engineering or bioscience. And I mentioned to him my story. I told him how I changed my career. And I told him what happened to you now is one of the turning point in your life. And you have to work on that and do love your work. The work will give you more than you expect. I gave him a motivation message and he was happy. And I told him, I'm going to call you after a few years. That time, I'm sure that you will have a good success in your work. We ended the call and I felt happy that at least I encouraged him for the new career. And I think also he was convinced of my talk. So I wished him a good luck. Recently, I have another call from another friend. He called me, Khaled, do you recommend my daughter to study medicine? I said, why I should recommend? You should ask her if she likes to study medicine or no. She said she does. I said, okay. So what is the problem? Can you supply the support to her with the fees? He said, yes, should not be problem. I said, then why you call me? He said, because actually she changed her mind because now she have some concern about the safety of doctor job. At the same time, she thinking in the future, she might not find a job because, as you know now, there is many online consultation and many technology, maybe one day replace the doctor. I said, come on. You know that I'm a chest physician long time. Those days, I used to deal with highly infectious tuberculosis patients. And I used to use infection control measures to protect myself. In addition, any doctor at risk at any time because he can examine any patient and he doesn't know this patient highly infectious or not. Number two, with the first coronavirus under SARS, severe respiratory distress syndrome 2003, and also Middle East coronavirus, which was 2013, I dealt with many suspected cases of two diseases, and I protected myself by wearing personal equipment protection, such as the mask, gown, all this one. And I'm safe. If you think that doctor job is the only job which has risk, I think the answer is no, because each job has its own risk, which may vary from one job to other job and even vary from one time to other time. And I can say there is no zero risk job. If you're concerned about the medical technology, I can tell you I use consultation online. I used to do it with my patient. And I use many medical applications to follow up my patient blood pressure, temperature, for example, blood sugar. This never replaced doctor physically. And per each online consultation, there is one question by my patient. Doctor, when we are going to see you in the clinic? In addition to certain diseases must be seen in the emergency or must be seen in the clinic. So I don't think that this medical technology is going to replace the doctor job one day. And we must understand this medical technology is to improve the outcome, is to help me to follow up my patient, is helping me to treat my patient. It will never replace me as a doctor. But if you think about medical technology, let me to tell you that it is not only online consultation. Nowadays, we have advanced medical technology, and let me to introduce to you Mr. Robot. Have you heard about Mr. Robot before? This is my Mr. Robot, is my new surgeon. This machine is going to operate patients. And many patients raise concern. How come I give my life to this machine? What will happen if this machine stops all of a sudden? I said, no worry. The expert surgeon is behind. He is the one who is operating this machine. And by his skillful hands, he is going to save you if anything happened to this machine. So, as you can see, that medical technology never replaces doctors. And actually, we are the one as the human who create any technology, not to replace us, but to help us in our job. Away from medical technology, let me to tell you about other technologies. Surrounding us a lot of ATM machine, and it will never replace banker job. Actually, we need banker to top up cash inside this machine. We still need bankers to work on our account behind the machine. And we cannot blame technology that cutting the job, because new technology also create new jobs. Like, for example, communication technology. Without that, we cannot have a very smooth and good transportation as Grab. Actually, some of the people starting to do a part-time job or even shift from taxi to full-time Grab because it's a new technology. And without communication technology, we cannot survive during COVID pandemic because food delivery is based on this technology as well. So we can't blame on the technology, but we have to work on ourselves to cope with any new technologies coming in. And in conclusion, what I wanted to say, no doubt that COVID has a great butterfly effect, and therefore we should cope with them. And We should not let COVID pandemic to change our future career plan, but if it happened, it may be one of our turning points in life. And now, it's a time to change our mind and thinking and learn new things and get ready to meet any challenge in our life. Thank you.